emergency declaration. Well, what a difference a week makes. This time last Monday, I said that South Australia had to rise to a new challenge to throw everything that we possibly could at this cluster so that it did not defeat us. And that's exactly and precisely what has happened. It hasn't defeated us, and South Australia has risen to this challenge. We stared down a catastrophic situation here in South Australia by acting swiftly and decisively on the expert health advice that we had received. And it's because of the action that we have taken, in conjunction with the great cooperation of the people of South Australia, that we have avoided this second wave, avoiding 100 cases per day by mid-December. I'm feeling very positive and I'm feeling very optimistic that as we head into Christmas, that we will be experiencing newfound freedoms and celebrating well with all of our family and friends this year. The fact that we have had no community transmission in South Australia is absolutely crucial. Let's be clear, every single one of the infections that we have reported can be traced back to source. I know that that is making our public health officials in South Australia very relieved, and I know that it is the important information that we need to provide to other jurisdictions so that we can hope to have our border restrictions eased as we head towards Christmas. Now, we already know that we are open to the ACT, to New South Wales. We thank the Northern Territory for lifting their border restrictions with us on the weekend. We're continuing to work with all other jurisdictions to provide them with the information that we need, and we're hopeful that we can normalise our borders as quickly as possible. My second point is that we are still not out of the woods yet. As Professor Nicholas Spurrier has said, we still remain very concerned about this cluster, and it is important that we still continue to maintain our testing regime in South Australia. Also hand hygiene, physical distancing and the wearing of masks when we cannot physically distance. These are absolutely crucial, and we do require the ongoing cooperation of every single South Australian. We're continuing to see fantastic testing numbers in South Australia. Last week, over 77,000. On Friday, we set a new national record in terms of the number of people tested per capita on a single day. Great results on Saturday, and I can report to you now that yesterday, on a Sunday, 8,689 tests. So great results. Sunday is historically always our lowest. We're very pleased with this result. Testing has been the cornerstone of our response to this COVID-19 pandemic. We know that people going off and getting themselves tested is the very most important thing that we can do. So anybody that develops even the mildest of symptoms, don't take 2 or 3 days to go off and get yourself tested. Go and get yourself tested as quickly as possible. The lines are very short at the moment. The turnaround time is very, very quick. So we're asking people with even the mildest of symptoms to go and get themselves tested and then to remain isolated until those test results come through. It's not luck that we've been very lucky or very fortunate in South Australia to stamp out other clusters previously, like the Barossa cluster, the Theberton cluster, and of course the Adelaide Airport cluster. It's not luck that we have performed well in South Australia. We've been very well supported by SAPOL right throughout this year, but also our wonderful clinicians that exist in our hospitals, within SA pathology, and in fact right across our state. For that, we're very grateful. One such person who is a real hero or heroine, as Professor Spurrier said 2 days ago, is the doctor out at the Lowell McEwen who first picked this up. And today I had an opportunity to speak with Dr. Darmany. What a hero she is in South Australia. This patient presented at the Lowell McEwen Hospital just over a week ago. None of the typical signs or symptoms of COVID-19. This very intuitive doctor administered the PCR test, and when the results came back, we knew that we had a problem. The great news was we picked this up. If this doctor hadn't have been on her game, this could have progressed very significantly. What we know when the contact tracers got in touch with her family, and put them into isolation, we know that a large number of them had already developed this infection. So if this wasn't picked up, quite frankly, we would have been in a very, very dangerous situation in South Australia. So on behalf of the people of South Australia, I've expressed my very, very grateful thanks to Dr. Darmany at the Lowell McEwen Hospital. I'm now going to pass over to Dr. Nicola Sperry to present us with the statistics for today. Thank you.
Thank you. Good afternoon. So we do have one more case in South Australia to report, and this is a case indeed linked to the Parafield cluster, but fortunately this person has been in quarantine since early last week and in fact has already had 2 negative tests. So she is part of the extended family group and had been part of a family gathering, but she has been in quarantine since Monday. And as I said, she's already returned 2 negative tests and has just been re-swabbed, because we're re-swabbing all of the close contacts, and we had an early morning result this morning that was positive. And it's rather interesting, I suppose, for people to be thinking, what was the incubation period? So when I was quickly calculating this, it looks like that's been about 8 days. So many people have had shorter incubation periods with this particular genomic clone of, or strain of this virus, but this person had a longer incubation period, and it absolutely tells us that anybody who's been asked to be in quarantine needs to be in quarantine for the whole 14 days, because there are people that have that very much longer incubation period, and certainly getting out to day 8 is quite a long period of time, but obviously the 14 days is of major importance for everybody who's been asked to be in quarantine. So in terms of our total statistics, there are 27 cases now linked to this cluster. We still have just one person hospitalised, and that's a person in his 30s, and he is stable, fortunately. But everybody else remain relatively well. We have obviously our cases in many hotels, and then many close contacts. There are some close contacts in many hotels, but the majority of people in quarantine are quarantining at home. We continue to contact all of those people in quarantine, and there's now well over 4,000. And we also, of course, are talking to people who live with them. And I just thought it was also useful to explain that we don't just do one interview with people who are close contacts. We actually continue to keep in contact and continue to re-interview. And on the basis of that, there are sometimes decisions made to add additional places of interest to our website. So one of the things I'd like every South Australian to do is to look at our website on a daily basis. You know, check the weather first, work out what you're going to wear, but then check our website to see if there are any sites of interest that we're putting up there, areas of concern, and please follow the instructions. And I was just talking to our comms team about trying to make sure that the new information is put right up the top so it's easily read for people. So in terms of our cases and testing stats, we've now got 38 active cases and 556 total cases. And as the Premier said, we had a very, very good result with testing, almost 9,000 yesterday, which is pretty good for a Sunday and is quite reassuring for me. But we need to maintain that testing. And if we don't have approximately, 8 to 9,000 per day, we're not going to be picking up community transmission. And there's mathematics behind that, but we know that we have to get everybody with symptoms, and it's not just in the north of Adelaide or not just in metropolitan Adelaide, but it is the whole of South Australia. And we've been surveying our population every week since the beginning of COVID and asking people whether they have respiratory symptoms and indeed whether they're getting tested. And for quite a long time it was only about 10 to 13%, so a very small number of people with respiratory symptoms who were getting tested. But this is the time, if there is any time in this pandemic, for anybody with even mild respiratory symptoms to get tested. We had that fabulous Dr. Darmany, and I do thank her sincerely, who thought and heard the cough and got the swab done. But we need all of our doctors to be thinking and testing, but we also need every South Australian to come to a clinic We've got a very good system now, lots of testing sites, so you shouldn't have any problems getting tested, and an extremely good turnaround time, so you'll be SMS'd when your result is through. So that's the first message really for this week. It is a critical week, this week and probably the week after, to have that high index of alertness about your own body and about your symptoms. But the other thing is we are not out of the woods yet. If we have had any community transmission, we will start to see it this week. And that's the reason why we're urging every South Australian to be wearing a face mask. It can be a disposable one, or the cloth masks are absolutely fine as well. Because that means if and when we do have another case, we will be able to do a risk assessment and work out who needs to go into quarantine, but also it has the potential to cut off that ongoing chain of transmission. It not only protects you, the face mask, but it protects the whole community. So when you put a face mask on and you think, oh gee, this looks a bit silly, or I feel a bit out of place, or it's a bit uncomfortable, you're protecting your own health, but you're also protecting the health of your family and your close friends, but also of the whole South Australian community. Now, we are looking at ways of trying to make the disposable face masks more readily available, and some of my team have been working with local government and other organisations to just try and make sure that everybody has a mask and they're accessible. Particularly some of the places that I was thinking about over the weekend where it would be useful to wear a mask are when you're out in the shops and you're going to be closer to people, and also the large shopping centres, you know, particularly those large busy shopping centres where you've got multiple shops. Have a mask in your pocket and pop it on when you go inside, and I'm sure the people who are serving you in the shops will be most grateful that you're wearing one. I think really I've come to the end of my update, but I would like to pass over to the Police Commissioner just to give an update from some of the other aspects that I know have been of concern to South Australians, and I'll be back to take any questions shortly. Thank you.
I don't have very much to say today. Assistant Commissioner Peter Harvey will be making a statement later on this afternoon in relation to the status of the investigation, so I don't intend to steal his thunder, and I'm sure you'll have plenty of questions for him at that time. Happy to take any questions before I hand over.
Is there any update at all?
Are there any questions?
Can we go back to the Professor since she has the lead?
Sure, absolutely.
Professor, can I ask you, have you been able to confirm the original transmission mode of this cluster? By that I mean, have you been able to confirm that the cleaner did get it by surface contact? Have you started looking at the CCTV you mentioned a few days ago? Yes,
so we have had discussions with SAPOL, and it looks like we'll have the CCTV footage analysed. The important thing with that is that it's done in conjunction with our Communicable Disease Control Branch, because they make a risk assessment of anything that they see on that footage. So we're very close to having that nailed down, and I can't update you today, but hopefully in the next couple of days I'll have more details.
Professor, can I just ask you, therefore, is it too early to rule out whether or not the cluster and the cleaner, the virus left Pepper's Hotel by a breach or by an accident? Is it too early to say which one?
Well, I'm not sure what your definition of a breach is. What I'm concerned about is, you know, what I'm interested in is there anything on that footage that shows that the virus could have been transmitted, whether that is by surface transmission or droplet transmission. And at the moment, from our the cluster investigation and the work we're doing now to contain it, the actual date and, you know, the time and when it happened is one of the most important things for me. But the second important thing for me is there something that happened that could be prevented happening again? And that's not just important for us in our own Medi hotels in South Australia, but it's also important that I provide that data and information nationally so that all the other states can learn, and we can make improvements and make sure it's prevented. And that's what public health is about, is prevention.
Professor, just back on masks, you've given us a pretty clear indication of what you're expecting going forward. What about on public transport? Because we've even seen this morning some sort of mixed messages coming out. Some bus drivers wearing masks, some not. Some passengers wearing masks, some not. Can you provide some really clear advice?
Yes, certainly, and I'm sorry I missed saying that. Public transport is where you are fairly close to other people. At the moment, we're also having a strong message this week to work from home if possible, and I am asking employers to be able to allow workers to work from home. It is an important week for us to try and reduce the number of contacts between people. But we will have people that require the use of public transport, and indeed I'm asking everybody that is taking public transport who is able to wear a mask during that period of time. I'm also asking, and we will speak again to the transport companies to make sure that their drivers are also protected.
You and the Premier and the Police Commissioner have all said previously that the quarantine system is constantly under review. Is this something you're talking to the AHPPC about, whether it needs a more national approach of review and a more national approach to people working in the hotels?
Yes, absolutely, because we can all learn from each other's experiences, and we need to be putting forward what is the absolute best practice across Australia, obviously because that's in the national interest. So I spoke to AHPPC at one of the meetings last week, and I said I really think this is the responsibility of AHPPC as chief health officers, as the medical experts, to pull together the evidence and provide a very factual list of things and recommendations to go forward. Now, we were lucky that we've had the Halton review, and that was very useful in itself, but I think it has proven, South Australia's proven exactly how transmissible this virus is, and even with the very best Medi-Hotel system, there are things that we could do better. So the Chief Executive of the Health Department has written also to the Chief Medical Officer of Australia and has asked for that to occur, and I'm looking forward to working with my colleagues this week on that.
Okay, what happened calls for an independent review? Are you saying that there will be, you support calls for an independent review into what's happened here?
So there has been, obviously the Halton review was an independent review.
I'm talking about an independent review into the last week.
Look, I'm not sure exactly what you're getting at, but what we do in health is we have we have regular audits of every part of our system, and this obviously is a high risk area, and the risk is increasing, and I knew the risk was increasing because of the increasing rates of disease elsewhere in the world, which was exactly why some weeks ago I might have mentioned to you that I followed one of the flights through, right from the airport right through, to have a look at whether there are any points where things could be improved. And that is called, it's a cycle of quality improvement, and you need to embed that. You can't be just waiting for something to happen and then do an intense review. You actually need to be embedding those quality processes all the time in your system, and that's what we do in health.
Professor, can I just ask you, regarding the 40 people that you were concerned about last week, have your contact tracers been able to make contact with all of them? And this week, are there any other particular locations of concern that people should be particularly monitoring their symptoms having visited?
I haven't got any particular ones to call out this morning, but I will say, as I mentioned before, the close contacts and contacts of close contacts are constantly being spoken to and re-interviewed, and if we find out any further information, we will put that out on social media. But I do ask South Australians to have a look at our website and get updated on a daily basis.
What's the status of these 17 suspected cases? Last week there were 17 suspected cases. How many of them have actually developed into cases, and have any been cleared?
So we're not going to use the term suspected cases because it was causing some confusion. There were some family members particularly who had symptoms and was at such high risk we were calling them suspected cases, and that was more from our communicable disease branch's perspective. So we will just be talking about close contacts. The 40 people and families that I mentioned that we had not been able to contact at the end of last week, I was very pleased to have an update from the team to say that they had got hold of everybody. And look, I walked through the branch yesterday afternoon, and I spoke to one of the senior people in that branch, and I said, how are things going? How are you feeling? And he said to me, we're doing the mopping up, which was very reassuring to me that they had got hold of everybody that is critical, but there were, they were just kind of tidying up loose ends, making sure that everybody had been contacted, making sure that questions had been answered, phone calls had been answered, and return calls made, and that's where they'd got to. So, like the Premier, I am feeling quietly confident that we have got on top of this now in South Australia. But everybody has a responsibility. We've got a responsibility to do the contact tracing and do the testing and make sure that we've got testing facilities available. I've got a big responsibility to make the best decision I can with the information available to me, make it decisively and at the right time. This week, every South Australian has a responsibility to come forward and get tested, and also think about wearing a mask when they can't physically distance.
Professor, just on the testing, we know how good the testing numbers have been, but are you sure that it's the right type of people getting tested? Our cameras have been out at Parafield the last couple of days, and there's barely anyone out there getting tested. Is it mainly the Warriewood?
So early on, at the beginning of last week, of course, everyone was thinking, oh my God, I need to go and get a test. And I also heard from one of my deputies that some businesses were requiring their workers to have a COVID test before coming into work. Now that obviously would block up the system, and it would mean that our turnaround time would get pushed out and we weren't getting the people tested we needed to. So we put in place, between SA Pathology and the CDCB staff, we've put in place systems to ensure that we're getting the people tested we need to have tested. We put out messaging that we don't want people without symptoms coming forward unless they've been asked to come forward. But the rest of South Australians, if you have respiratory symptoms, and even at this time of the year, we know a certain percentage of people will have developing a respiratory symptoms, a cough or a cold. Those are the people we need to continue to have tested over the next couple of weeks.
Professor, what's the modelling?
Professor, you say you're quietly confident at this point in this response. When will you be confident? Will it be Sunday, once we've got through 14 days since the first positive test related to this cluster? Is that the point in time you'll say, yeah, I think we're in a really good place now?
I think it's, from my perspective, I'm a very positive person. And I feel very, when I reflect back, I'm very confident about the decisions that we made last week. And I also feel extremely proud about the work that SA Health has done in terms of their contact tracing and really supercharging that really, really quickly and not just waiting. So normally when you have a cluster, you do wait for 2 incubation periods to say that it's all over, Red Rover. But we did get this very early on. We knew much more about the the transmission chains than we knew about the first outbreak. We know more about it than we did with the Barossa cluster, for example, where we still had people who had no links to any other person, so we had community transmission at that stage. I'm quietly confident, but in a sense it does depend on people coming forward and continuing to get tested this week. And also, of course, the masks are also important as a shoring up the place that we are now.
Professor, could I ask you, do you have any up-to-date modelling, and if so, what is it telling you? And what sort of restrictions could you envisage being in place in time for Christmas?
So just in terms of the modelling uses 2 bits of information. One, it uses a survey of all Australians because it's done for all states, and it also uses Facebook and Google data to look at people's movement around the state. But the second important piece of data it uses are the cases. And of course, we didn't have any cases in our state for quite some time, so it was based on sort of the theoretical modelling of what would happen if we did have a case in our state. And that's what I was explaining yesterday. So the survey is done weekly, and that's done by the Commonwealth, and that gets done on a Monday. So I've been told that we will have updated modelling either tomorrow or on Wednesday.
Can you please update us on what the expectation is for the 1st of December? I think the Police Commissioner said a couple of times we are still intending to remove that border with Victoria. Is that with or without quarantine? I can't remember where we were up to.
Yes, so that would be without quarantine for people from Victoria. Of course, Victoria has put border restrictions on their side as well at the moment, so it just, you know, we'll have to wait and see what decisions the other states make. But as the Premier said, we haven't had, technically we haven't had community transmission here, and I'm updating the other Chief Health Officers with what's going on in terms of our cluster investigation. In terms of other restrictions, we know that people are aware that we have put a cap now on certain venues. We have allowed gyms to open, which I think has been welcomed by the industry, and we've also got a more of a density requirement, so it's 1 per 4 square metres. So there are still restrictions in place this week. I would like to be able to have those reduced coming into next week, but we'll just need to see. Of course, if we do have any cases of community transmission, we'll need to have a rethink on that. But if everything goes to plan, that won't be the case. But I'm still going to require everybody to get tested regardless. That really is the mainstay of what we can all do to make sure we can get through this and not require restrictions into the future.
Professor, can I just ask, has there been any developments on whether many hotel workers can have second jobs? You were going to be seeking some advice from the AHPPC today. Have you done that, and what's their advice been?
So no, that hasn't come. That hasn't been discussed yet at a formal meeting, and so this is what I was saying before. We've now formally requested AHPPC to have a look at all of these aspects and come up with some recommendations.
Can I just quickly clarify your comments around CCTV? Are you talking about analysing CCTV from Peppers or from other many hotels as well?
So particularly Peppers, obviously, at the moment, because we know that's where the original traveller was, so that's key for us. But one of the things that I asked quite some months ago when we were setting up our Medi hotels is I really wanted to make sure that the hotels we had people quarantining in, that there was CCTV available. And that's one of the things when we look at using a hotel, we have a look at the way it's structured, the length of the corridors, whether there's a dog leg in the corridor, for example, because otherwise, you know, you can't see around the corner. And in fact, SA Health has ensured that CCTV has been installed at those critical points so that we can have that ability to go back in time. And the reason is exactly this, is to learn if we did have a problem, we can learn where that problem is and make changes.
Professor, could I just ask you, based on current trajectory and all the data and all your expertise, is the state still at risk of facing a second wave?
I think it's a little bit hard to make those predictions just at the moment. All I can say is we have done our absolute best. Looking back, I don't think there's anything else that we could have done better to avoid it. And that's really what we want to have, is no regrets.
Commissioner, can I just get an update from you as to what the advice is around regional travel at this point in time? South Australians, should they be going to holiday houses at this point, or should they be reconsidering that move?
I think the Premier did a really good job of explaining that yesterday. The advice is we've asked people to consider whether their travel is necessary. Maybe don't travel to the regional areas on a whim, but if you have a holiday house or another facility that you want to visit or maintain, if you are visiting family or friends that you'd like to keep in contact with or check up on or provide support to, if you have pre-arranged commitments that you've made bookings for, then we're more than happy for people to do that. We're simply asking everybody, regardless of what you're doing, just to consider the necessity of that travel or that activity. We're still in the position where we're asking people to have some level of suppression on movement throughout the community until we're confident that this particular cluster has been fully encapsulated and we don't have any more concerns about seeding within the community.
Do you have any updates on fines over the past 24 hours?
My understanding, there were 6 fines issued and several cautions. Some of those were for people who were not complying with their quarantine requirements. There were 3 people who were not found to be at home, so we've dealt with those people.
Just on bride, we've had a lot of brides contacting us saying, you know, will they be able to dance at the weddings? When these restrictions lift on the 1st, when do you think dancing and stand-up drinking could be back at the weddings?
Well, the direction we had in place up until around about the 15th of November allowed for private gatherings, including weddings, to have stand-up drinking and dancing. And we're aiming at this point, as long as we are satisfied that we've captured everybody within this parafield cluster, that we will return to those levels of restrictions which were reasonably accommodating for the broader community on the 1st of December. So fingers crossed, we don't have any further concerns. So people who have their plans for any event after the 1st of December will be able to have private gatherings of stand-up drinking and dancing.
How's
Commissioner,
it
are you
looking for your
concerned
daughter's
about...
wedding? How's it looking for your daughter's wedding?
It's a toss-up at the moment. We're just looking at whether we can get that back on track, but lots of family discussions at the moment.
Commissioner, are you concerned about complacency and compliance? We've come out of a hard lockdown, and I think there's a great sense of relief that is swept across the state. Are you concerned, therefore, that people might not understand that we are still in an era of quite heavy restrictions?
I think we saw, as of midnight on Saturday, there was this sense of intense relief, and I think we probably saw a surge of activity, particularly around shopping centres and other places like that. And we just ask people to remember that we are still in a very concerning time, and that we need to remember the physical distancing rules and also the gathering rules. I just want to reiterate, by and large, people are doing an excellent job in helping us deal with COVID-19 in the South Australian community. It's simply just a reminder, these rules are in place. Let's not let complacency be the thing that brings us undone.
Just on that, how disappointing was it, considering how well people who have been in quarantine have been behaving over the last week? You had to hand out 3 times in the last 24 hours to people who weren't.
I'd rather focus on the fact that 1.7 million people in South Australia have been doing a fantastic job. We always know, whenever you have rules in place within a community, there's going to be a cohort that choose to disregard those rules, and I suppose that's why we're here, to hopefully pick up those people and stop them from causing harm to the community.
A bit of a random one for you. I'm not sure if you've been briefed on it, but Millicent, there's been a situation where 5 women were found unconscious in a house. It's believed they were eating cannabis cookies. This must have been a bit of a shock for your officers when they turned up and worked out what was going on.
Well, I'm sure you can imagine turning up to that scenario without the clarity of exactly what's going on. The response, I think, was quite effective. Obviously, these people are receiving medical attention, and we've been able to get to the cause of their health concerns, and we're continuing to investigate.
It's a little bit of a warning for people, I guess. Some people think that consuming a substance like that in a cookie might be safer than consuming it in other ways. I'm guessing that's not the case.
Well, yeah, regardless of what illicit drug you're talking about, there is no safe way, and particularly when you're talking about something that's been prepared by another person, you have no ability to appreciate exactly what you're putting into your body. So we just tell people to exercise extreme caution. There are better things to do.
Just back on the cluster, are you concerned, having established that one confirmed case wasn't truthful about their movements, are you concerned that any of the other confirmed cases may not have been truthful about their movements?
That's a difficult question to answer, because the contact tracing team is dealing with thousands of cases, and they're interacting with these people on a daily basis. We're relying on people to tell the truth. We're relying on their forthrightness, so that we can get the best picture possible of where these people have been, who they've been in contact with, so we can throw that net out wider. The contact tracing process relies on an element of confidentiality between the person they're speaking to and the team, so that people can feel that they can be honest and truthful. Once again, the old 80-20 rule. 80% of the people do the right thing, and we deal with the 20% who cause us problems.
So are police checking any of the movements of any of the other people? Are you checking any of their claims? Are police involved in that or not?
Well, we do have certain lines of inquiry in relation to the Woodville Pizza Shop cluster, and I'm sure you're all aware of that, and Assistant Commissioner Harvey will give you more details later on this afternoon. Beyond that, we rely on the contact tracing team to provide us the information that will instigate any sort of further work by the police. It's not a regular course of action, as you can appreciate, with so many people subject to contact tracing. We are doing as much as we can to support their efforts, and we'll certainly respond when we're requested to by the contact tracing team.
Just on Task Force Protection, I'm not asking for an update, but on radio a short time ago, somebody compared the number of detectives put on this task force compared it to Snowtown, saying it's a huge response. Can you just explain to the public why the need to put 20 detectives on this case?
It's not a fair comparison. We're talking about vastly different things. There's a high level of public expectation that we'll find some answers to this. It is in the public interest that we do establish as much as we can the circumstances around this particular event, and it is a standard investigative practice for us to direct significant resources in a very short space of time to capture as much information as possible so that that information doesn't go missing. That's simply the process we've taken here, and I'm sure Assistant Commissioner Harvey, as he goes through the investigation process, will scale up or down those resources as necessary. But in the first instance, it is hit it hard and hit it fast, so we get as much as we possibly can.
Commissioner, could I ask you the question I asked the Professor earlier? You know, you've got your daughter's wedding to worry about. I'm sure your family would like to know what to do for Christmas. What hope can you give the general population about what we might or might not expect leading up to December 25?
Well, I think it's been made pretty clear. We're all reasonably optimistic that Christmas will be celebrated as we would hope to celebrate it. I've given a pretty clear indication that we're aiming for the 1st of December to go back to a level where most community activities and family gatherings could occur as we would hope them to. So, you know, we're still aiming for that.
And can I ask you, when it came to the gentleman who wasn't truthful with contact tracers, you all said last week that his story didn't add up. Do you know when that first emerged, and then when did detectives go and interview him in relation to the decision to lock down?
That sounds like an excellent question for Assistant Commissioner Peter Harvey this afternoon.
Premier, can I ask you?
Thank you.
Thank you, Commissioner. You've been pushing very hard today, this morning, and again at this press conference, the fact there's been no community transmission in South Australia. How concerned are you that in other jurisdictions that message isn't going to get through and isn't getting through, and therefore border restrictions on South Australian arrivals will be kept in place longer than you believe they may need to be?
Well, I've just got to emphasise that we have no example of community transmission in South Australia since right back in April. We know the epilink, we know the origin, we know the source of every single one of these new infections. The vast majority of them, of course, have either come in through our hotel quarantine, so returned Australian citizens caught in our hotel quarantine arrangements, or people linked to this cluster, 27 people. So we know the source for all of our infections in South Australia. This gives our public health officials in South Australia great relief. We're now passing all of that data through to the other jurisdictions. Now, I won't name the jurisdictions that we're in discussion with, but suffice to say, we're sending them that information. We're hopeful that they will lift the restrictions with South Australia as soon as possible.
Premier, this morning your colleague Nick McBride called the lockdown an overreaction. Have you spoken to him, and what do you say to him in response to that?
No, look, I haven't seen that or heard that. Obviously, I've been in Cabinet this morning, but I just point people to the excellent information that's been provided by Nicholas Spurrier and our Police Commissioner with regards to this emergency. We acted very, very swiftly and decisively on the expert health advice, and by doing so, we avoided a catastrophic situation for our state.
He said it was an overreaction to one person and it wasn't a thorough enough investigation. There needs to be clarity about what happens there, and to lock down one state just based on what one person said was way too far. You were pretty strong over the weekend in response to what Peter Malinauskas was saying about reassessing the Medi hotels. Are you going to say that to your own colleague, that these comments are disgraceful, disgusting, unnecessary?
Look, what I'll say is that there is very clear advice. We did not rely on just a single person's evidence. There was very good advice and detail presented by Nicholas Spurrier yesterday on exactly and precisely the catastrophic situation that we faced, with a 99% confidence that we were heading for an epidemic in South Australia and that we would have cases numbering around 100 by mid-December. Now, the people of South Australia worked with SA Health, worked with SA Police, worked with the government to avoid an absolute disaster. Now, I'm quite aware of people that have different opinions, but I just say listen to the expert health advice. That's what we've been doing, and it's kept South Australia safe and our economy strong since.
Professor Spurrier has suggested, strongly recommended that people using public transport wear masks. Is this something the state government will consider making mandatory for transportation, public transport?
So strong advice at the moment. Now, if you're on a piece of public transport and there's nobody else on it, then we're not, going to be checking every single person that is on that public transport. But we know that in many times during the day that it can be very crowded. In that situation, our strong advice is that people need to have masks on. It's not a direction at this stage, so it's not enforceable. But what we've seen right since day one in South Australia is that people in South Australia do the right thing. We're wanting people to be physically distanced wherever possible at the moment, especially in this period leading up to the 1st of December.
So you won't make it enforceable or mandatory?
There's no plan to make it. There's no plan to make it enforceable or a direction at this stage. But we are asking people to abide by that strong advice that we've provided.
Premier, the Small Business Commissioner is calling for a full independent investigation into this last week and beyond that. Will you support that?
Well, as we've said in our press conferences today, there is an investigation into each new infection which is done within SA Health, and I have every confidence that SA Health will do that. In addition to that, we've written to the AHPPC. Dr. Chris McGowan, the Chief Executive of the Department of Health and Wellbeing, has written to the AHPPC because we do want to have consistent new arrangements with regards to Medi-hotels. And more broadly than that, every time there is an emergency in South Australia, one of the things that we do as a state is we do have an investigation. I have no doubt that there will be an investigation into our response to COVID-19. You would have noted that we were the first state to do a review into the bushfire emergency earlier in the year. That was done by Mr. Keelty. We've received that, we've responded to it, we resourced the response to that, more than $100 million in our state budget. And so there will be an investigation that follows this pandemic as well.
But Premier, what about more specifically about the events of the last fortnight, including what happened at Peppers and then the subsequent response?
Well, just
particularly as well as the broader COVID.
Yeah, well, look, there's multiple investigations that are underway at the moment, and one of the most important ones that the people of South Australia want to know about is the information that has been provided to our contact tracers in South Australia. That investigation is underway at the moment. Task Force Protect, it's well resourced, and Assistant Commissioner Harvey will be providing an update later today. Can I also just update that my understanding, further to what Professor Spurrier said earlier today, is that we have been working through that CCTV footage regarding Peppers. It's a long and laborious job because we're looking at footage going right back to the 2nd of November when this person from the UK arrived here in Australia. That's my understanding, and that work is around about halfway through.
Over the weekend you said there wasn't any plans for compensation for any businesses affected by this lockdown, but might you consider extending your second round of small business grants to businesses that were affected by this 3 days?
Look, that's something you'd have to direct to the Treasurer, and I'm sure he'll make himself available.
Some of them have said they're tens of thousands of dollars down. I mean, yes, it was only a few days, but if they can't get support, it's really hard.
Look, I think in our budget that's just been brought down, we've got around $5 billion worth of support and stimulus for the economy. We've been working with the federal government, who have provided both an increase to the job seeker as well as the job keeper. Many companies are eligible for support. Many employees are eligible for support. There is also specific coronavirus support for employees that are required through a direction to isolate for 14 days or even to go and get tested. So $1,500 and $300 for those people who don't have sick leave available to them. We do that for very good and obvious reasons, and that's something that we learnt from the situation that occurred in Victoria earlier in the year. We are also, don't forget, very not considering, but rolling out elements of our budget, which include a full payroll tax relief for all small business in South Australia with a payroll of up to $4 million per year, and that's a 15 months relief for payroll tax. So there is quite considerable support and stimulus for our economy at the moment.
But that grant, that $3,000 or $5,000 grant, depending on the structure of the business, could probably go a long way, but at the moment you have to be getting JobKeeper to qualify for that. Would you look at changing that, or could you recommend to the Treasurer that he look at changing that?
I'm happy to raise that specific issue with the Treasurer. I think it's a good suggestion. So what we're doing at the moment is providing a $10,000 cash grant for businesses that remain on JobKeeper, and a $3,000 cash grant for those smaller businesses, so sole traders or partners that don't employ other people. And so that is part of the budget announcement that we made recently.
What about regional tourism operators? I mean, they've gone through this last week. They've had, again, things come and go very quickly. Do they need assistance as well?
Look, again, look, the situation is that we are providing significant stimulus and support for many businesses in South Australia. We don't have a compensation arrangement or an equalisation arrangement. Our focus has been to get as many people stood back into work and employment as quickly as possible. So yes, we do appreciate that there were many people who had lots of cancellations to reservations in regional South Australia and metropolitan Adelaide. My goal is to get businesses stood up as quickly as possible so that we can get those reservations back in place as quickly as possible.
Have you had a chance to look yet at what Victoria's implemented in regards to workers in the hotel quarantine, employing them under a government contract exclusively to work in the hotels?
So I know that Premier Andrews made some comments about the direction he was seeking to take. That hasn't been implemented yet, but in the meantime, Dr. Chris McGowan has written to the AHPPC asking for their advice so that we can have a consistent national approach. So, of course, every jurisdiction is able to take their own action. You saw that in South Australia when Professor Nicola Spurrier moved very quickly on Monday last week to put a mandatory 7-day test in place over and above the mandatory declaration on the start of every shift within our quarantine hotels in South Australia. That quick action actually picked up the person at the Stanford. And that was very fortunate that we picked up the person at the Stanford in those very early days.
Is there any indication, it's probably on for the Treasurer as well, but how much that would cost if that is a recommendation of AHPPC for the government to employ all those security guards exclusively?
No, but I know it is something that Professor Nicola Spurrier is asking the AHPPC to consider. In fact, she's just gone to attend the AHPPC meeting today. And can I just say, we have fully resourced the approach here in South Australia right from day one. But there are, there are often conflicting views on what we should be doing in response to Medi hotels. The point I would make is that we rely in South Australia on the expert health advice. So even though the AHPPC advice was not to have mandatory testing in our quarantine hotels in Australia, when Nicola Spurrier and SA Health made the recommendation this should happen, it happened day one in South Australia. This has been our approach right from the outset of coronavirus, to listen to that expert health advice and to take decisive action to put their recommendations into place as soon as possible.
Thank you.
How's your arm?
What up, Betty?
I just got that.
I don't know.